You may all ask, again what? We grant you the right to feel exhausted, but again, it's better to know about it to prevent getting it. And again, Munch is here for you to warn you and give you all the information you need to know to stay healthy. Watch this video all the way through so you know what to do not to get sick. A new and potentially more transmissible coronavirus variant first identified by South African scientists has prompted a fresh round of travel restrictions across the world and raised concern about what may be next in the pandemic. On November 26, the World Health Organization designated this strain known as B11529 as a variant of concern and named it Omicron, on the advice of scientists who are part of the WHO's Technical Advisory Group on SARS-CoV-2 virus evolution. The detection of Omicron triggered a global alarm. According to the WHO, researchers in South Africa and around the world are conducting studies to better understand many aspects of the Omicron variant. As of now, this is what is known. The first question that we're about to answer is what's the difference between Omicron and other variants? While mutations and new variants of the virus are expected as it continues to spread, experts say there's more reason for concern with Omicron. The Omicron variant has lots of different mutations that haven't been seen before and many that have. A large number of them are on the spike protein of the virus, which recognizes host cells and is the main target of the body's immune responses. Such a dramatic change has raised concerns that the antibodies from previous infections or vaccination may no longer be well matched. But what do we know about Omicron? Very little is known about how the variant acts or how much of a threat it could be. For example, it is not clear if it spreads more easily, if it makes people more unwell than other variants, or if protection from vaccines will be less than previously thought. But the data has triggered enough concern for precautionary measures. The next thing we need to know is what the symptoms of the Omicron are. So far in South Africa, most people infected are young and their symptoms have been mild. There's some suggestion that the variant could be causing some slightly different symptoms to Delta, including aches and pains and no loss of taste or smell, but it is too early to say for certain. At the moment, the World Health Organization says there's no evidence that symptoms of Omicron are different from those of other variants. That means a new cough, a fever, and loss of taste or smell are still the main three symptoms to look out for. Hospitals in South Africa are seeing more young people admitted with more serious symptoms, but many are unvaccinated or have had only one dose. This suggests that getting 2 doses and a booster dose is a good way of protecting against disease caused by a new variant, as well as all other variants. Transmissibility. It is not yet clear whether Omicron is more transmissible compared to other variants, including Delta. The number of people testing positive has risen in areas of South Africa affected by this variant, but epidemiologic studies are underway to understand if it is because of Omicron or other factors. The severity of disease. It is not yet clear whether infection with Omicron causes more severe disease compared to infections with other variants, including Delta. Preliminary data suggests that there are increasing rates of hospitalization in South Africa, but this may be due to increasing overall numbers of people becoming infected, rather than a result of a specific infection with Omicron. There is currently no information to suggest that symptoms associated with Omicron are different from those from other variants. Initially reported the infection were among university students, younger individuals who tend to have the more mild disease, but understanding the level of severity of the Omicron variant will take days to several weeks. All variants of COVID-19, including the Delta variant that is dominant worldwide, can cause severe disease or death, in particular for the most vulnerable people, and thus prevention is always key. Effectiveness of prior SARS-CoV-2 infection. Preliminary evidence suggests there may be an increased risk of reinfection with Omicron. It means people who have previously had COVID-19 could become reinfected more easily with Omicron, as compared to other variants of concern, but the information is limited. Effectiveness of vaccines. WHO is working with technical partners to understand the potential impact of this variant on our existing countermeasures, including vaccines. Scientists do not expect that the variant will be entirely unrecognizable to existing antibodies, just that current vaccines may give less protection. But they remain critical to reducing severe disease and death, including against the dominant circulating variant, Delta, and remain effective against severe disease and death. So a crucial objective remains to increase vaccination rates, including third doses for at-risk groups. The last thing you should all know is the most effective steps individuals can take to reduce the spread of COVID-19 virus. Keep a physical distance of at least 1 meter from others. Cover your mouth and nose with a well-fitting mask. Open windows to improve ventilation. Avoid poorly ventilation or crowded spaces. Wash your hands often with plain soap and water. Cough or sneeze into a bent elbow or tissue. Get a COVID vaccine. The ubiquity of Omicron may be of concern to many people, but you should pay attention to your mental health and focus on what you can do rather than what you cannot to keep safe. This is your responsibility. This is what you can control. Follow the health tips, calm, and stay safe. Thanks again for watching us, and please subscribe to our channel and like this video.